If you're like most people, you visited a pharmacy to fill a prescription, either for yourself or a loved one who's not feeling well. You've probably relied on the pharmacist to fill your medication accurately and to provide important information regarding that medicine, such as common side effects and potential drug interactions with other medications you might be taking. Despite the best efforts of your doctor and pharmacist, there are times when adverse effects occur after starting a medication, or the effectiveness of a prescribed medication may not be fully realized. In order to promote the safe and effective use of medications, a growing number of health plans are offering to their members a benefit commonly referred to as medication therapy management. This benefit, typically offered at no additional cost to covered members, is designed to help patients get the best results from their medications. It is centered around you as a patient and involves both the pharmacist and prescribers involved in your care. One example is a comprehensive medication review, which is designed to help identify or prevent drug complications, reduce costs where appropriate, and help you get the most benefit from your medications. This video will define and demonstrate a successful medication review.
Hi Jim, thanks for coming in.
Sure.
The focus of our meeting is to identify all the medications you're taking. We'll talk about possible medication-related issues or cost savings opportunities. After we finish, I'll send you a copy of your updated medication list. Okay, let's talk a bit about your current medical conditions. I've noted them based on the medications I've filled for you, but I'd like to confirm that these are correct and we aren't missing any.
Sure, okay.
The conditions I've identified are diabetes, asthma, and high blood pressure. This correct? Anything that I've left off?
I don't think so. But in the past, my doctor has told me my cholesterol is high.
Your doctor ever prescribe any treatment?
Years back, yes. My doctor gave me a prescription, but my neighbor told me she uses something over the counter. It works, so I've been using that instead.
Do you know the name of the product?
Yeah, fish oil.
Okay, I'll note that. We'll talk about it when we address your over-the-counter medications.
Okay.
Before we discuss your prescription meds, can you tell me if you have any allergies to medications or foods?
No, I don't have any allergies. Well, none that I know of.
Any other health issues or concerns?
Well, I've started to get a strange tingling in my feet. Do you think this could be related to any of my meds or conditions?
It could be a complication of your diabetes called neuropathy. It's something I can discuss with your doctor to see if you might benefit from a medication to help relieve that symptom. Would that be okay with you?
Well, sure, that'd be great.
I've started a list of all the medications you've filled at our pharmacy. Let's review and confirm that these are still current.
Okay.
I see that Dr. Nguyen has you on 500 milligrams of metformin for your diabetes. Are you still taking this?
Yeah, I've been on that for about 5 years.
And how are you taking it?
Twice a day with my meals.
Perfect. That's what my records show. It can be difficult sometimes to remember when and how to take medications. Many patients miss a dose here and there. During an average week, how many doses would you say you miss?
Well, I do pretty well remembering both doses. But sometimes I forget to take my dinner dose. I'd say I miss maybe 1 dose per week.
That's perfectly understandable. And there are various tools to help you stay on track with your therapy. We can talk about this after discussing your other meds.
All right, good.
Metformin can sometimes upset your stomach. It can also cause some side effects like nausea, vomiting, and diarrhea. Have you in the past, or are you currently experiencing any of these side effects?
No, none of those side effects.
How about your blood sugar readings? How have they been since starting metformin?
Well, they've gone down a lot since I started using it.
Good. And how often are you testing?
Every day. I test every day after lunch.
According to my records, the doctor also wanted you to test in the morning before breakfast. Does this sound correct?
Yeah. I stopped testing in the morning to cut down on the amount of strips I'm using. That and, well, my sugars after lunch have gone down a lot, so I figured it was okay.
Well, it's good that your glucose readings after a meal have gone down, but since you're also using insulin, it's important that you also test in the morning. The reason we have you test on an empty stomach and after a meal is so that we can see how your body is handling sugar, both while at rest and after eating. The goal is that your readings will stay at a fairly even level instead of having wide swings back and forth.
Guess I didn't know that. Well, I'll start testing twice a day again, but I will need to get a refill of my strips while I'm here.
No problem. We'll take care of that after we're finished. Now, before we move on to your next medication, do you have any questions concerning your metformin?
No, I don't believe so. That about covers it.
Okay, now that we've been through your prescription medications, did you bring in any over-the-counter meds, vitamins, or supplements?
Well, I brought in ibuprofen. I use it sometimes when I get a headache.
How often would you say that you use it?
Oh, maybe once or twice a week.
Is it effective for you?
Yeah, but I don't use it all that often because sometimes it upsets my stomach. But it does make my headache go away.
All right, I'll add that to your medication list. One thing you may want to try is taking acetaminophen or Tylenol instead. This will be easier on your stomach. It's also a better option due to your high blood pressure. Tylenol won't increase your blood pressure like ibuprofen can. Well, I think we've gone over everything that I'd planned. Any additional questions or concerns that you have today, Jim?
I can't think of anything.
Great. Well, thanks so much for coming in. I'll finish updating your medication list and send it out to you in follow-up to our appointment today. Like we mentioned, I'll also consult with your doctor about a medication to help with the tingling in your feet and discuss your recent cholesterol levels to see if they're well managed with the fish oil. If there are any changes to your regimen, I'll contact you. Does that sound okay?
Oh, that's fine with me. Thanks for your time. This was really helpful.
You're welcome.
We hope this demonstration of a successful comprehensive medication review has given you a better understanding of what should occur when delivering this service. With 4 out of 5 adults taking some sort of medication daily, and the high cost of noncompliance to the healthcare system, the value of a CMR should be clear.